Understanding urinary challenges, incontinence, and urgency. Urinary incontinence, simply put, is the unintentional loss of urine. It's a common problem that affects millions, and it's nothing to be ashamed of. Urgency, on the other hand, is the sudden, intense urge to urinate, often with little warning. Think of it like this. Your bladder is a storage tank, and the muscles controlling it act like a valve. Incontinence happens when this valve doesn't work properly, leading to leaks. Urgency is like a faulty alarm system, going off even when the tank isn't full. These conditions can range from occasional leakage to more frequent and heavier losses of urine. It's important to remember that both incontinence and urgency are symptoms, not diseases themselves. Understanding the underlying causes is crucial for finding the right treatment and regaining control over your bladder health. Let's delve deeper into the common causes of these conditions. There are various reasons why someone might experience incontinence. Sometimes it's temporary, caused by factors like urinary tract infections, constipation, or certain medications. Other times, it's linked to underlying medical conditions. Diabetes or chronic kidney disease, for example, can damage nerves that control the bladder. In men, prostate problems can lead to incontinence. Neurological disorders like stroke or multiple sclerosis can also interfere with bladder control. Pregnancy and childbirth can weaken pelvic floor muscles, increasing the risk of incontinence in women. Menopause, too, plays a role due to hormonal changes. Being overweight or obese puts extra pressure on the bladder, making leaks more likely. It's important to note that these are just some of the common causes. Each individual is different, and a thorough evaluation by a healthcare professional is essential for accurate diagnosis and treatment. The symptoms of urinary incontinence can vary from person to person. Some experience minor leaks when they cough, sneeze, or exercise. This is called stress incontinence. Others have a sudden, uncontrollable urge to urinate, often followed by leakage. This is urge incontinence, also known as overactive bladder. Some people experience both types. These symptoms can significantly impact daily life. The fear of leaks can lead to social embarrassment, anxiety, and even isolation. People with incontinence might avoid activities they enjoy, limit fluid intake, or constantly worry about finding a bathroom. It's crucial to remember that help is available, and you don't have to suffer in silence. Treatment options. Finding relief and regaining control. The good news is that urinary incontinence is often treatable. The first step is to talk to your doctor. They'll determine the type of incontinence you have and recommend the best course of action. Treatment options range from simple lifestyle changes to medications and, in some cases, surgery. Lifestyle changes might include losing weight, quitting smoking, and reducing caffeine and alcohol intake. Pelvic floor exercises, also known as Kegels, can strengthen the muscles that control urination. Medications can help calm an overactive bladder or relax the bladder muscles. For some, surgery might be an option to repair damaged tissues or improve bladder support. Your doctor will discuss the risks and benefits of each treatment option with you. Prevention and seeking help, taking charge of your health. While not all types of incontinence are preventable, there are steps you can take to reduce your risk. Maintaining a healthy weight, staying hydrated, and eating a balanced diet are essential. Regular exercise, including Kegels, can strengthen your pelvic floor muscles. If you smoke, quitting is one of the best things you can do for your overall health, including your bladder health. Don't hesitate to see your doctor if you experience any symptoms of urinary incontinence. Early diagnosis and treatment can significantly improve your quality of life. Remember, you're not alone, and there's no shame in seeking help. With the right information and support, you can regain control of your bladder health and live a full and active life.